So another thing to note about two of those hip flexors in particular, tensor fasciae latae and sartorius, is that they attach to the outside and the inside of the lower leg bone, the tibia. And when the knee is bent, the tibia can rotate relative, the tibia and fibula together can rotate relative to the thigh. And actually one of the other functions of the sartorius and the tensor fasciae latae is to help control rotation of the shin relative to the thigh when the knee is bent. There are other muscles, the hamstrings for instance, which also assist in that rotation because the hamstrings also attach to the inside of the tibia and the outside actually to the top of the fibula. So all of these muscles not only affect the hips, they can also be used to affect rotation of the shin relative to the femur. Now a point to note is that when the knee is straight, such as when you are bending forward in an attempt to stretch the hamstrings, the shin does not rotate relative to the femur. Instead, the shin and the femur rotate as one unit. And so those same muscles which, with the knee bent, can be used to rotate the shin relative to the femur. With the knee straight, they can be used to rotate the shin and the femur together relative to the hip joint. If the shin is stabilized, say by the foot muscles, those muscles then don't have to work in order to stabilize the shin against rotation. They can instead be used, in particular the hip flexors, those muscles with the shin rotationally stable can be used to help tilt the hip bone forward. So how do you stabilize the shin so that those muscles are anchored? One way is, I've talked about this in previous videos, is to stabilize the foot, in particular make the ankle feel stable. So these are all important things to bear in mind when trying to use the hip flexors to stretch the hamstrings.